Thank you very much, Mr. Chairman, for the kind introduction. It's a pleasure and honor to be here again in the DAR International Alliance annual conference. It gives me the honor to be in DAR International Conference repeatedly, and hopefully that we're adding more insights to the science in diabetes and Ramadan. I've been asked to cover one of the studies that we have conducted over the last couple of months, where we focused on the risk evaluation in people at low risk and low risk of fasting Ramadan who are on multiple oral hypoglycemic agents. So this data is the sub-analysis of the DAR Global Survey. That's what's conducted between the year 2020 and 2022. And our main aim of this sub-analysis is to evaluate the impact of fasting on low-risk category people with diabetes based on the International Diabetes Federation and DAR International Alliance risk stratification engine. And by virtue of having the label of low risk category, we have excluded people on insulin, or people on sulfonylurea, people on who had micro or macrovascular complications, specifically in microvascular complications, including microalbuminuria, low EGFR, and those who were labeled as CKD. Few patients were having retinopathy or neuropathy, and they were included. We thought that this might not impact significantly the risk of hypoglycemia in this subgroup. So we have included those microvascular complications, and anyone with macrovascular complications has been also excluded from the study. And as you all aware that the IDF DAR risk calculator or stratifier is an available risk stratification engine for both professionals and for patients as well. And this has been subclassified into low risk group, moderate risk, and high risk group. And the data that we're presenting now basically focusing on the low risk group, and whom, by virtue of being at a low risk, are able to fast with a very minimal risk of having this fasting on their health and outcomes. But as per the recommendation of the IDF DAR guidelines, that this risk stratification has to be repeated annually, because those circumstances might change, having either upscalation or downscalation of risk category. So our patients, they were just above 2,307 patients who has been surveyed between the year 2020 and 2022, as I've just mentioned. Almost 45% of those patients aged less than 50 years. And almost 80% of them did have a short duration of diabetes, that's to say less than 10 years. And 2/3 of them did have an HbA1c of less than 7.5. More than 87% did have an HbA1c less than 9%. Almost 90% of patients had an HbA1c of less than 9%, which all in all gives a picture of potentially low risk of having complications upon fasting Ramadan. Regarding the pharmacological management, we've just mentioned that we have excluded the sulfonylurea and insulin. So majority of patients were on metformin plus or minus DPP-4 inhibitors, TZDs, SGLT2 inhibitors, GLP receptor agonists, and only few of them were on alpha-glucosidase inhibitors like carbose. 1/4 did have hypertension, 1/4 did have hyperlipidemia, and only a handful of patients that have retinopathy or neuropathy. But important to note that almost 1/5 of those patients did have nothing, no complications at all. So all in all, this gives the characteristic of low risk group of upon fasting Ramadan. Expectedly, majority of patients managed to fast the whole month of Ramadan with no interruption. But unexpectedly, that 1/4 of those patients had to break their fast at some point. So only 73% of our population managed to fast the 30 days of Ramadan. 22% managed to fast between 22 to 29 days. 4% managed to fast just more than half of the Ramadan days. And interestingly, 1% managed to fast less than half of Ramadan days. And this again is an alarming sign that why around 5% of patients manage to fast just 20 days of Ramadan or less. And as just to remind you, this is a low risk category. So there is something that we need to be alerted and taken care of in the coming future in terms of either further studying or education. Interestingly, almost 1/4 of the patients had to break their fast, not only not to fast, but they had to break their fast due to diabetes-related complication. 27% had to break at least 1 day or more during Ramadan days. And again, this is a low-risk group. So those who experienced hypoglycemia were around 8% of the total population. This out of those, 7.8% had hypoglycemia in more than 8 days. That's to say, every third day, those patients or those who experienced the hypoglycemia were having or suffering from an episode of hypoglycemia. Again, this is a patient at low risk of fasting Ramadan, having hypoglycemia every third day. This is just in around 8% of patients, and 92% of those patients who experienced hypoglycemia had the incidences or the experience less than 8 days across Ramadan days. And not different from the previous data, those who experienced hypoglycemia, only half of them did break their fast. And this is again puts more responsibility on our shoulders, the healthcare providers, that we need to educate and re-educate the patients. Whenever they have hypoglycemia, they need to break their fast, even in the late hours of fasting, for the fasting hours. Out of those who experienced hypoglycemia, 3% they suffered from severe episode to extent that they had to visit the ER. So 3% of those who had hypoglycemia, they were sick enough to attend the hospital for diabetes-related complication during the fasting hours, which are all significant features or significant findings that may change our understanding about having low risk of fasting in this particular group of patients. Okay, so what about the previous data? Much, actually. This is a study published a couple of years ago where they evaluated the comparison between the low and high risk of category in people with diabetes, and it was a prospective study. It was a relatively small study, and people at low risk were just around 62 and 86 on the high risk. So a total of 148 patients. And in this study, in contrast to what we found in our study, that people at low risk, they managed to fast in at least 29 days in mean, and none of them did have hypoglycemia, neither mild or severe or any type of hypoglycemia. So in our study, a reasonable number of patients did have hypoglycemia, and some proportion of them did have severe hypoglycemia to the extent they visited the emergency room. Another study from Qatar, the ProFast Ramadan, which was published a couple of years ago, they subclassified patients into groups A, B, and C and D, where group A, B, and C, on the background, people were receiving insulin or sulfonylurea, while in group D, the people did not have sulfonylurea or insulin in the treatment regimen. And the risk of hypoglycemia in this group, which is more or less matching our group, none of them did have hypoglycemia. Again, it's a small study, 228 patients compared to 2,000 plus patients in our study. So at least this gives it opens the appetite for a future further assessment on the incidences of adverse events of fasting in people at low risk of diabetes in Ramadan fasting. Just to wrap things up, I've just went back to this old sub-analysis or meta-analysis on the risk of hypoglycemia at different hypoglycemic agents, basically the DPP-4 inhibitors compared to either metformin or sulfonylurea, pioglitazone, or GLP-1 receptor agonist. And they were reporting either symptomatic hypoglycemia or the documented hypoglycemia. Yes, symptomatic hypoglycemia in the DPP-4 group, they were a handful of patients here, around less than 2% of patients. Here is just probably, again, 1% of patients did have symptomatic hypoglycemia. But when we go to the confirmed hypoglycemia, it goes down to 0 in DPP-4 inhibitors group. When compared to sulfonylurea, again, the symptomatic hypoglycemia was higher, significantly higher in sulfonylurea group. Almost half of the patients did have hypoglycemia in this study, compared to just probably less than 1% of patients here. Or sorry, less than 10% in these patients in symptomatic hypoglycemia. Again, when we go to confirmed hypoglycemia, maybe 0 in DPP-4 inhibitors, but it's also on the higher side in sulfonylurea group. Comparing it with pioglitazone, again, handful cases of hypoglycemia. So the hypoglycemia, it does occur even in people with DPP-4 inhibitors or pioglitazone or GLP-1 receptor agonists in multiple evidence or multiple studies in the clinical literature. So with that, dear colleagues and friends, Mr. Chairman, that please allow me to conclude that low-risk group is a correct label since they have a residual risk of negative impact of fasting, and it's not no risk of fasting Ramadan. 27% of the low-risk category broke their fasting for at least 1 day or sometimes more than 1 day during Ramadan. 8% of patients did have hypoglycemic episodes for more than 8 days during Ramadan. Despite hypoglycemia, only half of the patients broke their fast. Hypoglycemia remains a potential risk even in relatively short diabetes duration with no complications and not being on sulfonylurea or insulin. Education and empowerment may complement the risk stratification to guard against the negative impact of fasting. And with that, I'd like to thank you very much and happy to answer any questions after the coming talks. Thank you.